it just was mind-boggling to me that all this money gets spent on drug research, on genetics research, on all these things that, people are looking for ways to manipulate a chemical or a gene so that they can license it with some big pharma or biotech company and make millions or billions of dollars. And then you have nutrition over here, the 800-pound gorilla nutrition sitting in the corner, completely being ignored and neglected.
All right. I'm here with Dr. John Lewis today. Welcome to the Medical Entrepreneur Podcast. We're so excited to have you here. For our listeners, can you tell us a little bit about, who you are and your journey into health?
Thank you, Dr. Sewell. It's my pleasure to be with you today, and I'd be happy to talk a little bit about my background. I'm a physiologist by training. I spent about 20 years at the University of Miami Medical School conducting clinical trials in exercise training, dietary supplementation, and a bit of dietary modification. And I got tired of begging governments and foundations and even individuals in some cases to raise money to do research and talk about the word entrepreneur. For those of your listeners who don't know, anybody that was in my position, and I'm sure this isn't just at the University of Miami, this is across the country, people sometimes think of a professor as being this guy who lives in an ivory tower and he teaches his students and he gets paid this big salary to, sit around and look knowledgeable or whatnot. That could not be further from the truth. We are definitely entrepreneurs, just in an academic environment, in the sense that we have to raise money not only to pay ourselves, but our staff, our laboratory space, our studies, you name it, everything. So being an entrepreneur in an academic setting obviously is a bit different than being an entrepreneur in business, but still they're very, very similar propositions. And so fundraising is the heart of both of those, whether, again, you're in academics or in business. But it's been a little over 7 years ago now that I left academics. And being in business is obviously no bowl of cherries either. You're still trying to raise money, but now you're trying to raise money from customers as opposed to grant funders or bureaucrats. So you have to, you obviously have to become now more of a marketer. But I feel like what I can offer to your listeners is the opportunity to hear someone's perspective who was in academics, again, for a couple of decades and conducted all this research and then took what I believe is the most exciting parts of that research that we published, my colleagues and I, and turn that into a dietary supplement business. And I feel, the path that I'm on today, again, is challenging. It's certainly not easy. It's like the old saying goes, if it was easy, everybody would do it. But it's an opportunity to take this information, all of this research we published, and we are still publishing, actually. We've got a paper under review right now from our multiple sclerosis study that would be the 7th paper that we've published in this one particular line of research on polysaccharides from our Alzheimer's and multiple sclerosis trials that support the foundation of our flagship product called Daily Brain Care. But that's a little bit of a background about me. I also consider myself, somebody who's personally invested or committed to the idea of health and wellness, not just being somebody that researches it. I've eaten a plant-based diet. This is my 27th year now. I used to be a drug-free competitive bodybuilder. I still weight train every day. Strength training for me is at the top of my list of health priorities. And then taking these polysaccharides every day, it's something that I learned about 20 years ago that I like to share with people as well. So I definitely am the person who, I'm following the path, and I'm not being a hypocrite of, talking about health and wellness and then sitting around all day eating McDonald's and never exercising and not taking my own products. So I think personally and professionally, I have the combination of, the credibility of science combined with trying to be a good, legitimate, ethical marketer at the same time, and then having all of this work that I've done to support all of that, and then living it, again, living this lifestyle of being health and trying to model health and wellness for other people who maybe are confused or, as you well know, as a physician, it's just overwhelming the number of epidemics of chronic disease we have in our country today. And whether you believe the Institute of Medicine, WHO, CDC has any credibility or not at this point politically, they still say that, a lot of the chronic disease we deal with today could actually be prevented if people ate well and they exercised every day. And of course, obviously eating well is a very controversial thing as well. I mean, I'm sure you probably have listeners who are going down the paleo, keto, carnivore path that probably think, just because I eat plant-based, I'm crazy. But so I know that eating well is definitely very controversial or argumentative as well. But nonetheless, regardless of what your approach to all of that is, it's really sad to me that we have so many people riddled with obesity, type 2 diabetes, different forms of heart disease, cancer, depression, you name it. I mean, the list just goes on. And a lot of these things could unfortunately be prevented if people ate well, exercised every day, and did, a few other things lifestyle wise that they don't end up having to be on a life of, the remainder of their life on medications and then dealing with the side effects of polypharmacy and all those kinds of things. So my mission is just to continue educating people about the value of health and wellness and how these polysaccharides from aloe vera and rice bran actually can be utilized as a tool in the toolbox to help people achieve those goals.
Yeah, absolutely. I think, you really hit the nail on the head. Like, I think there's so much misinformation out there because, you have all these different camps of people that are this diet or that diet. And then, recently we actually had a lady that came on the podcast. Her name was, she was actually from Moms Across America, and her name was Zin Honeycutt. And she was just a mom who basically started testing the food that her children were eating and found they were full of glyphosate, Roundup. And just, one thing after another, we're just, we're kind of seeing our institutions in which we had faith in, essentially crumble in front of our eyes, and now it's very confusing for a lot of people. We do see a massive amount of cognitive dysfunction that's happening in the American population. And so anything you could talk to about, what is it that, with all of your knowledge and your amazing, all the research you've done and figured out, these supplements, how do we, like, as a physician or as a medical practitioner, how can I A, learn that information from you? And then B, like, how do I use it to not only help myself, but also my patients?
Absolutely. Great question. So, and if I may, I'll just say that, a lot of people related to the glyphosate issue, a lot of people are totally against wheat. And of course, if you have a gluten sensitivity or God forbid you have celiac disease, something like that, obviously gluten could be a serious issue for you. But I think a lot of people who think that they are responding to wheat, they're actually responding to the glyphosate in the wheat, as per what your other guest had shared with your listeners. So I totally think that this issue of pesticides, herbicides, and that's why I buy organic. I mean, we try to shop almost entirely organic. And again, of course, there's always questions about, well, what's actually organic? Organic by law, by definition, is supposed to be non-genetically modified and not treated with any chemicals, including glyphosate. So that's the reason why I buy organic, and I'm putting trust in the system. I'm putting trust in the farmers and the producers and the people that are bringing those foods to market, that they are actually organic. So I'm taking that step in terms of my own, how I value different things in terms of what I look at. But going back to our research, I mean, I think number one, you go to drlewisnutrition.com. That's our primary website. We have a whole host of information there around our research. Again, this is primarily focused at this point on our clinical trials on people with Alzheimer's and people with multiple sclerosis, which are two of the, I don't know if the three leading, including Parkinson's, forms of neurodegeneration. I don't know the exact numbers of every single cause of neurodegeneration, but certainly they're two of the top three, or top 4 or 5 anyway. So we have a lot of information summarized there. I've been doing a lot of podcasts with folks such as yourself, and we've been trying to spread this message across as many different social media platforms as we can for the practitioner, for somebody who's a physician or a nurse practitioner, chiropractor, some higher level professional. I'm more than happy to share the publications. Again, we've had 4 papers published from the Alzheimer's study, 2 papers published from the MS study, and we've got a third one currently under review. So that one will hopefully be published in the next, it's the middle of July, so I'm hoping by September or so. I mean, we have a very extensive publication track record. And again, even though I'm no longer in academics, wouldn't call peer-reviewed publishing in my top 10 list of priorities on a daily basis. But I do think it's important to continue, publishing as much as I can scientifically. So, and I'm happy to work with people. I mean, individually, anybody like you, Dr. Sewell, any of your colleagues, any people that I'm always an open book in the sense of as much as I can, as much time will allow. I'm happy to work with people individually to help them understand the benefits of this stuff. So, I think there are multiple ways that people can learn more about our research and what we've showed, and then how they can utilize that information in their practice. But if you'll give me just a moment here, I will help to educate people here right now. And that is the sense of, these polysaccharides. I mean, number one, I always use, it's an interesting point where psychologists say that there's this teachable moment where, people hear a word and they may be confused by it, or they may not totally understand what that means. And so I'm sure, like you, I had at least a little bit of education about saccharides and biochemistry, but what I learned about saccharides going all the way back in those days was that basically saccharides were used as a fuel source for the cell, and that was about it. I had no clue what these potential polysaccharides could mean for us in terms of health. And of course, the other thing is that you hear the word sugar, and I could have said complex sugar instead of polysaccharide. It means the same thing. But as you well know, in the last, 30, 40, maybe even many more years than that, we've had sort of this ongoing public national dialogue about the idea that sugar is bad for you. So I think almost any American, when he or she hears the word sugar, he is led to believe, well, that means something bad, right? You hear the word sugar, you may like the fact that sugars are sweet and they taste good, but they may be bad for you. But that's a very ignorant use of the word, and I'll tell you why. Because a sugar is not a sugar, meaning that sugars are dependent on two very important characteristics. Number one, their source. So high fructose corn syrup is a monosaccharide, and we know that spikes your insulin, it spikes your glucose, it causes all sorts of metabolic complications over a long period of time that you ultimately would like to avoid, to not end up with diabetes or heart disease or both, or cancer. But you have polysaccharides, and of course the one in between is a disaccharide like sucrose, which is a little bit more complex. But the polysaccharides from the ones from aloe vera and rice bran in particular that my colleagues and I have conducted all of this research on are just incredibly dense and loaded with information that are very beneficial for us. So our genes do nothing until they receive information from the environment. And these polysaccharides are so dense with information. Essentially, that's what everything is that we stick in our mouth, whether we like the taste of it or not. But our genes interpret that information, and then they guide the cells in how to function, whether that's to our benefit or not, depending on what we're consuming. But these aloe vera polysaccharides and these rice bran polysaccharides, again, in my experience, I've witnessed nothing else like them in terms of their ultimate effects literally on every cell in the body. So through the study of glycomics and glycobiology, we know that these particular polysaccharides can be very beneficial to health. So I would just like to, kind of summarize that up by saying that please be mindful of your language or the use of the language. Like, don't just say sugar is bad and make a blanket ignorant statement that quite frankly is factually incorrect. Make sure that you use proper context around the word sugar, because again, it depends on the source of the sugar and its biochemical complexity. These things are way more significant than just as a fuel source for our cells. They actually have very dynamic immunomodulatory effects that, again, my colleagues and I have shown time and time again in our research. So I think it's important, again, just to be mindful of the language and use the language properly and then go from there. And so, it's an opportunity for people to learn something new that they probably never even thought about before. I mean, you mentioned the word aloe vera. Most people just think of aloe vera as you use the gel on a sunburn or a cut or a wound or something. And that's an okay use of it. I'm not saying there's anything wrong with that, but it's far inferior to actually consuming those polysaccharides in a concentrated powder source where you can have a therapeutic benefit. The aloe vera gel is 98.5, 99% water. So you could not possibly drink enough aloe vera gel or liquid to get the amount of polysaccharide you need to have any kind of therapeutic benefit. And that, a lot of times when people hear me talk about aloe vera, that's one of the first things they think of. If they're not already thinking in the concept of, well, how can I use this? If they do go to that point, then they think, oh, well, I'll just drink some aloe vera gel, and that's the same thing that Lewis is talking about. No, it's actually not. It's far different than that. Again, you'd never drink enough aloe vera gel to get enough of the polysaccharide in a therapeutic content. And then on the rice bran side, unfortunately, rice bran is typically milled off of rice. Most of the rice sold in the world is white rice. So the bran has been stripped off. That's what's left, that white endosperm that most of the world prefers to eat. So the bran either gets thrown away or fed to livestock. So people are not even, typically, unless you're eating brown rice every day or some other type of colored rice that hasn't had that bran stripped off of it, you're not even getting any of that nutritional benefit. And I would still argue that even if you do eat brown rice every day, you're still probably not getting a concentrated enough amount of it to really have a therapeutic benefit. And especially in light of, any type of health challenge. And I should also say too, I think it's a good point to just mention that please don't misinterpret anything that I'm saying related to using nutrition to treat disease. I'm not saying that at all. What I'm saying is nutrition provides the raw materials that the cells need to be able to function properly. And if you do have a health challenge, whatever that may be, hopefully your body can restore itself to homeostasis. And that's a way, as you well know as a physician, that's a way different paradigm from taking a drug, which is a chemical, which alters a metabolic pathway to try to treat a symptom that, because of that alteration, results in side effects, which is by definition what we refer to as drugs. So that's the pharmacological model, which is very, very different from the nutritional biochemistry model. So I just want people to make sure they're clear. I never want anybody to say, well, Lewis said you could use nutrition or supplements to treat disease. No, I've never said that. I never will say that. Again, I'm saying that you utilize these nutrients, that the genes interpret that information from those nutrients, tell the cells how to function, and then through the body's own internal intelligence can hopefully repair and restore and heal itself. So that's something I also want to be very clear about today in our conversation.
Absolutely. And then for people that are not familiar with your research, could you maybe talk about like what you found? It sounds like you found
Absolutely.
Polysaccharides in the aloe vera and also in the bran of rice. And then,
Yes.
What did this do to help with brain health? And
we studied people. We ran a 1-year clinical trial in people. I'll talk about the Alzheimer study first, and then I'll mention the MS study next. But with people with moderate to severe Alzheimer's disease. So again, as you well know as a physician, those are the people Big Pharma cares nothing about. They look at people at that stage of severity basically as a waste or as hopeless, essentially helpless, whatever. But we wanted to look at these people because, again, they typically are not eligible for any type of clinical trial. And we felt like, we had an opportunity based on Dr. Reg McDaniel, who, by the way, is also in the Dallas area. He's the person who actually introduced me to this whole line of work that he had gotten into back in the late 1980s as a pathologist who then started basically practicing nutrition. He went from running a pathology lab at a hospital in the Dallas area to practicing nutrition. But based on some of the work Dr. McDaniel had done up to that point, not in clinical trials, but just anecdotally working with people with dementia and Parkinson's, we felt very confident that we could do something with this clinical trial that we had only had the opportunity to conduct because of a family that had listened to Dr. McDaniel speak. They were very encouraged by the work that he was doing, and they had lost 4 family members to Alzheimer's disease. So they made a donation to us to do this research. So I want to acknowledge both of them. But again, we ran this clinical trial, and again, people with moderate to severe disease, the worst, form of this tragic, terrible disease that's now about the 5th or 6th leading killer of Americans. I think we now have 6 million people with Alzheimer's and then another 8 million or so with different forms of dementia. But we looked at cognitive functioning at baseline, 3, 6, 9, and 12 months. Unfortunately, we only had enough money in the budget to draw blood at baseline in 12 months, but that was essentially the design of our study. And Dr. Sewell, what we ended up showing was beyond anything we expected. So the ADAS-Cog, for those of your listeners who don't know, if you're not a neurologist or a psychiatrist, you probably don't know, but the ADAS-Cog is considered to be the gold standard for assessing cognitive function, particularly in people who have any form of dementia. And of course, assessing cognitive function is basically a proxy for brain health, right? I mean, you can do an EEG or some sort of graphics, but in terms of assessing brain health, we look at cognitive function as really the so-called gold standard for brain health, and the ADAS-Cog is considered the gold standard in doing that. At 9 and 12 months, we showed clinically and statistically significant improvements in cognitive function in our study. That's unheard of. We published that first paper in the Journal of Alzheimer's Disease back in 2013. It's hard to believe that's been 11 years ago. But the editor of the journal actually called me. We submitted that paper, and he called me. And this had never happened, and it still never happened in my career. And I've had now, I'm going on, I think, 190 papers in my scientific publishing career. But I actually got a call from the editor of the journal and who said, Dr. Lewis, I can't believe the results that you guys have showed in your study. I want to publish this paper immediately. I mean, that, again, for those of you who know anything about publishing in peer-reviewed science, that never happens. Like that's like a Nobel Prize winning moment or something. But anyway, we showed that, and I want to make sure that people are clear that I mentioned clinically and statistically significant improvement, because you can have large numbers. We only had 34 people in the study. It wasn't like, we had hundreds or even 1,000 people. Again, we only had a small budget, but when you have something clinically significant, according to the ADAS-Cog, that's a change of 4 points or greater in either direction, either improvement or deterioration. But we showed this 4-point improvement that is considered clinically or practically meaningful to people. So in other words, it wasn't just a statistical finding. It actually was a difference. And it really supported a lot of the phone calls that I was getting as we were running the clinical trial. I would have caregivers or staff people calling me up and saying, I can't believe what my loved one is doing, talking about things again, doing things again. The oldest lady we had in the study, she was 93 at that time. I believe she had been diagnosed for like 11 or 12 years. And when we enrolled her in the study, she was sitting in a chair. She couldn't walk, and she basically didn't say anything. I mean, she was almost just like the piece of furniture she was sitting on every day. And at some point before we had the first assessment at 3 months, she actually walked into the center one day and she called one of the coordinators by his first name. That guy started crying like a baby. I mean, it was so emotionally moving for him. And I get chill bumps every time I tell this story. I'm getting them right now. But it was so emotionally moving and powerful for him that it was just like nothing he expected. And so we had all of that type of response as we were running the study, and then the statistics bore it out as we published that first paper. But on the cellular side, on the physiological side, we showed a statistically significant improvement in the CD4 to CD8 ratio, which, as you know, that's our ratio of helper to cytotoxic cells. That's important for all of us as we age, not just people with Alzheimer's. We showed reductions in TNF alpha and VEGF. Our paper was probably the first paper that ever showed that in people with Alzheimer's in response to a dietary supplement. I mean, those proteins are typically looked at in heart disease and cancer. And then we also showed just under a 300% increase in adult stem cells according to CD14 cells. So that was all published in that first paper in 2013. Again, just really incredible, encouraging findings. We published 2 subsequent papers after that looking at brain-derived neurotropic factor and how that correlated. Unfortunately, it didn't change statistically significantly over the 12 months. It went up by, I think it was 11 or 12%. So it wasn't statistically significant, but we looked at several different relationships with some of the immune and inflammatory markers in one paper, and then in some of the cognitive markers in the other paper. So we got 2 more publications there. And then the 4th paper we published just this past year at the end of 2023, I had an idea to look at the Th1 to Th2 ratio. That had never actually been done before in people with Alzheimer's disease. And I was thinking about this in the context of inflammation. And as you well know, neurodegeneration, just like any other chronic or typical disease, you can't acknowledge that disease without thinking of how inflammation or chronic inflammation fits into that role or into that etiology. Well, I started looking in PubMed. I could not find, believe this or not, I could not find at that time, this is again going back to early of 23, I could not find one other paper that had ever characterized or even considered the idea of the importance of the Th1 to Th2 ratio in the immune system and how that relates to Alzheimer's disease, and particularly in light of the link between, neurodegeneration and neuroinflammation. And for those of your listeners who don't know, just very generally speaking, the Th1 is your pro-inflammatory to your Th2, your anti-inflammatory side of your immune system components. Those two components have probably been studied more than any other components within our immune system. And this goes all the way back to, I believe that first paper was published in 86 in a mouse model of HIV, where some people were looking at how that might have been important back in those days for HIV. But anyway, we had all of these proteins, all these cytokines and growth factors. So I calculated those ratios in our sample. And then we had another study of healthy adults we had studied with a completely different dietary supplement. We had all the same cytokines and growth factors. So I was able to calculate the ratios from that study as well. Compared the two, the people with Alzheimer's disease were wildly Th1 dominant. I mean, their numbers were like through the roof, just very, very high values. And then the people from the healthy adults, they were all like close to 1 or 2. I mean, it was a very, very stark difference. And then over the course of the 12 months and taking our dietary supplement, 5 of the 6 ratios, they didn't get anywhere close to 1 or unity, but at least they were going in that direction. And then those, I call it sort of rebalancing of the Th1 to Th2, that rebalancing effect was correlated with improved cognitive function. So that was, again, just another beautiful paper that had never been, any kind of information like that had never been published before. And it was also just sort of one more step in our journey, if you will, of how the immune system and the central nervous system or brain health or cognitive function, these sort of related things all in that part of that domain of that organ system are related, how intimate, the crosstalk is between these two major major organ systems and how they function together. So I'm very proud of all of that research. Again, I don't think there's anything else. I mean, if you look at, and I know that Ornish just recently published a study, and Ornish is big into lifestyle, not just in supplementation. I don't even know if Ornish does any supplementation work, but I know he just recently published a study in people with, was it either mild cognitive impairment or early dementia? So it wasn't the same population that we looked at. And then, there are other people out there looking at different dietary and lifestyle modifications as well. But I mean, compare our results to any other type of dietary supplement, any type of diet, exercise training, hyperbaric oxygen, acupuncture, music therapy, red light therapy. I don't care what, I mean, really, and I don't mean to sound arrogant when I say this, but, and, please, any listener who can find something on PubMed or anywhere else, I would love to know anybody else or any other group who has showed the type of results that we've showed in our research, and tell me about it, because I really want to know something else out there, if there is, that could actually show what we've showed. And again, I'm not talking about using nutrition to treat disease. We don't claim that we've reversed Alzheimer's or any, nonsense like that. We just have showed the ability to help support people improve their quality of life through this nutrition. So all that research was just very powerful for me. And I should also tell your listeners that really that research was kind of the beginning of the end for me in academics, in the sense that you can imagine when we published that first paper in 13, I mean, man, I was on top of the mountain, right? Like, I was so excited, and I thought we were onto such a big discovery here. And so from 13 to 17, when I left academics, that was about a 4-year period there. I tried twice with NIH, and I tried twice with the Alzheimer's Association, submitting them proposals with data, actually showing, hey, look, there's something here to all of this. Can you help us extend this research? Can you actually help us, continue proving up what we're demonstrating here and actually do something for people with this horrible disease? And I ended up getting crickets in response. I got nothing. So I went from like, on top of the mountain. I didn't go in the valley. I tell people I didn't go in the valley. I went below the valley. Like I was under my just aggravation and disappointment and anger and all those emotions. I was so it just was mind boggling to me that all this money gets spent on drug research, on genetics research, on all these things that, people are looking for ways to manipulate a chemical or a gene so that they can license it with some big big pharma or biotech company and make millions or billions of dollars. And then you have nutrition over here, the 800-pound gorilla nutrition sitting in the corner, completely being ignored and neglected. And so that was the beginning of the end for me in academics. And I knew that I refused to spend another 20, 30, how many ever years I have left in academics, banging my head against the wall, trying to get bureaucrats to see what we'd published and the value of what we published. But in addition to the work with Alzheimer's patients, and oh, by the way, I didn't mention these people were on average 79.9 years of age. They had been diagnosed with the disease at least for 1 year. So these were not newly diagnosed people. And they also didn't just have Alzheimer's, right? I mean, they had diabetes, depression, different forms of heart disease, other comorbid issues. So these were very sick, very old folks. And we showed some really incredible findings here based on their response to our nutritional supplement. And then just briefly, I'll mention in the MS study, these were people with relapsing remitting MS. And so obviously, on the cognitive level, they're not as severely as impaired as they are on the functional level. But we showed very similar findings, just as exciting in the Alzheimer's study. I mean, we showed, and actually, for those of you who don't know, people with MS don't die of neurodegeneration. They die from infection. So infection is the leading cause of mortality in people with MS. We went from 7.9 infections at baseline to 2.5 at 12 months. Just so exciting. And that's another one of the mechanisms of actions of these polysaccharides is they're very anti-infective, be it virus, bacteria, whatever. I mean, they just really knock the crap out of infectious or pathogenic agents. So that was the first, really exciting thing. The FAMS, the functional assessment of people with multiple sclerosis, is the gold standard for assessing physical functioning in people with MS. We showed, and it has several different subscales and domains. We showed almost all of them statistically significantly improved across the 12-month intervention. I think there were one or two that were not statistically significant, but the other 7 or 8 were very statistically significant. In terms of immune function and inflammation, we showed, again, very, very much similar to the Alzheimer's study. We showed changes in inflammation, improvements in overall immune function. Epidermal growth factor is a protein that's very important for remyelination, which obviously is very important for people with MS. So we showed a very nice statistical improvement in that protein. And then all the other quality of life, overall global quality of life, depressive mood type symptoms, cognitive symptoms, all these other types of different functioning and domains, they all statistically significantly improved as well across the 12-month period. And then that third paper that I mentioned that's currently under review, it's a sister paper actually to the Th1, Th2 Alzheimer's paper. It's very much similar to the same concept as the Alzheimer's paper. I just for the sake of, respecting the journal, I won't talk about that yet, but we showed very similar improvements there, or similar changes, I should say, there is in response to our supplement as well. So to sum all of this up, I mean, these polysaccharides are just incredible immunomodulators that, really for anybody in practice who likes using nutrition or, wants something simple. I mean, and this is from a research perspective, not a clinical perspective, but when I compare all the types of research studies that I conducted in my career, and I mentioned nutrition, supplementation, and exercise training, by far, as you well know as a clinician, getting somebody to just take something in addition to what else they do every day is a way easier tool, especially if it's efficacious and it actually works, compared to getting to trying to get somebody to change their diet. I mean, how hard is that? Or trying to get somebody to exercise 3, 4, 5 days a week. How hard is that? I mean, these are very intense lifestyle behaviors that you really have to support people with. But if you can just introduce a supplement, say, here, take this, once a day, twice a day, whatever the dosing schedule is, that is such an easier thing for the average person to do. And especially, unfortunately, as we live in this sort of, quick fix or magic bullet, instant gratification society. I mean, unfortunately, that's what people do. And I should mention, in both of our clinical trials, we didn't change anything about diet or exercise or medications. All those other variables stayed the same. Like we wanted people, unless it was an emergency situation, of course, where they needed some sort of extra treatment, we wanted people to basically continue, and whether it was the patient or the caregiver, continue doing the same thing every day, just like they had never changed, other than just introducing the supplement into the daily routine. So I think for any of you, that are listening to this, that are saying, well, wait a minute, maybe Lewis has got something here I can use in my practice to help my patients. Absolutely. I mean, it's such an easier solution or an easier modification from a lifestyle behavioral perspective than trying to get people again to change their diet or get them to go to the gym 5 days a week. So that's kind of a summary of where I am today and, the exciting work that we've conducted. And I'm happy to work with anybody and, anybody who again has a genuine interest in wanting to learn more. My door is always open and I'm willing to help anybody who would like to do that and work with me on that level.
That's amazing. So basically, to kind of summarize it for some of the practitioners, would you say that if basically you have a patient or maybe even a family member who has cognitive decline, and many times it's not clear, especially ever since the vaccinations, that, the cause, like we have a lot of people that got vaccinated and now they have cognitive decline. It's not as clear, like, was it that? Was it COVID? What exactly caused all this to happen? But basically, for those people, would you recommend using the polysaccharides to treat them, basically to help with the therapy, I guess?
Oh, absolutely. So I have a very good friend. This poor guy, he had COVID twice. He took 2 of Pfizer shots. I think I'm pretty sure he took 2 of the Pfizer shots. And then he ended up in the ER. He thought he was dying. He thought he was having a fatal heart attack. And it turns out he had myocarditis and pericarditis. I mean, just really severe. He was intubated, the whole 9 yards. Yeah. For like 4 days, he was in the hospital. He thought he was dying. So I said, Michael, you've got to take daily brain care. I mean, this potentially, is going to save your life. Again, not treating disease, but helping the body to repair and restore itself. So he had already sporadically taken it. I mean, he was kind of one of these, kind of like my wife, one of these people that you have to like sort of go back and forth with in their own neuroticism or skepticism or whatever until you finally sort of, get them over the hump. But I had him on a pretty big dose for quite some time. And now his heart he's pretty well normal again. I mean, he's back to exercising and, not feeling like he can walk across his neighborhood without collapsing over from fatigue or anything like that. So yes, anybody who's dealing with negative side effects of these injections, I would highly encourage people to use this simply because of the way that it works with the immune system and helping to lower inflammation. I'd love to run a study in looking at things, related to this spike protein formation and how these polysaccharides could help counteract that. I think there's great potential there, but as I'm sure and all of your listeners, it takes money to conduct research, and unfortunately, I'm not really I'm not at a point in my business's life cycle where I can fund a lot of research on my own. I have to do that very selectively. I am trying to work with a couple of people here and there with some new research ideas, but it's challenging when you don't have a big checkbook that you can just, you got a blank check there to say, hey, how many zeros can I put on that check? And let's run a big study here. But yes, to answer your question, anybody suffering, whether it's again on the neuro side or the cardiovascular side, the immune side, neuropathy, pain, any of those kinds of things. I mean, we've had tremendous success with people with all sorts of chronic, non-healing conditions, and then they start taking the polysaccharides, and the next thing you know, they're having all sorts of improvements. So yes, I mean, to answer your question, that's a definitive yes.
And this is basically because the polysaccharides cause an immunomodulatory effect that decreases inflammation?
That's right. Along with improving oxidation status, along with improving your adult stem cell production process. I mean, there are lots of different mechanisms of action here. And just so that everybody's clear, I mean, our flagship product is called Daily Brain Care for more of a marketing purpose, not a scientific one, meaning that we chose Daily Brain Care, number one, because of the clinical trials we conducted in Alzheimer's and MS. So our own research supports the claims on the label related to, anything related to the brain or brain health. But number two, you know better than me as a physician. I mean, literally anything from birth to death, you have, whether it's children with autism or attentional issues to neurodegeneration toward the end of life, and then all of us in between dealing with, things like mood disorder, concussion syndrome, TBI, all of these sorts of things. So literally the brain health issue or interest spans cradle to grave. And then from a conventional perspective, I mean, look at what the typical medication can do. I was lecturing a couple of weeks ago and getting people to really wrap their mind around the idea that exercise is actually, in a lot of studies, exercise is actually more effective than the SSRIs are in terms of controlling mood symptoms. So, make sure you understand what you're doing here before you just load people up on a bunch of medications. I mean, if you haven't tried exercise before you start writing a prescription for Zoloft, you may want to reconsider that. So, to me, it's the brain health issue just really affects every segment of our society. But so that's just the label, that's just what we call the product. But to your point, our formulation, the body doesn't care what the name is on a label. The body will utilize whatever you provide for it. And so these polysaccharides, again, I would put them up against, anything else you can think of. I mean, curcumin is obviously a very good one. Curcumin is an amazing material as well, but it has to be formulated properly. If it's not in a liposome or a micelle, the liver is going to rapidly break it down and you're not going to get any benefit of it. And all you're doing is basically pooping your money down the drain. But the polysaccharides from aloe vera and rice bran, man, I would just put them up against anything else in terms of the published work around them. And again, not just from our lab, but from other people around the world, and looking at how these immunomodulatory and other effects are just so profound and so beneficial. So it doesn't matter if you feel like you're in perfect health. I mean, I've been taking my own formula. Let me share this little anecdote with you. So I've been taking my own formula for over a decade now. I've had my mother on it for 15 years. She started out with potentially needing a knee replacement, never did have to have a knee replacement. Her orthopedic surgeon was shocked that she never needed a knee replacement after she started taking them, not too much longer after I had met Dr. McDaniel initially, and I asked him what he thought they would do for people with, serious arthritic conditions. And he said, well, I don't have any studies. I don't have any data to share with you, but he said, I've got some anecdotal cases of people that have had very nice responses. So mom's never had to have a knee replacement. She's been on it a solid 15 years. When my wife was pregnant, this is going back to 19. So she started, at that point, I finally got her. I said, honey, you really got to start taking this stuff. We want you to have a healthy pregnancy and, have a healthy baby. And so she started taking them when she was pregnant. Our baby was born healthy as a horse. Angie just turned 4 back in March. And I've had Angie taking them since she turned 6 months old when we started introducing solid food into her diet. And so I mentioned, these examples to say that it's not just for people with a health challenge. It's, in my view of the world, prevention is just as important as treatment or rehabilitation. Why not try to prevent something from happening to you in the first place? So I feel like, these polysaccharides to me are just as important. I mean, we know that oxygen is our first nutrient, but, we need vitamins, minerals, essential amino acids, essential fatty acids. To me, these polysaccharides are just as important as anything else as, besides oxygen, basically. And so I'm trying to prevent stuff like this from happening to me and my family, rather than waiting till you have that teachable moment. And then you say, oh my gosh, now I have cancer. Now I have dementia. Now I have heart disease. Now I have diabetes. What am I going to do? Well, no, let's try to prevent that stuff in the first place from ever happening. So part of my strategy is utilizing these polysaccharides as best as we can to hopefully avoid those things from happening to us. So yeah, I mean, to me, there's no, if you're living and breathing and you can swallow you have, I mean, unless you're destitute on the street, homeless, and you have zero money, there's no reason not to consider, what these can do for you, both from a preventative perspective and from a treatment perspective.
And then recently, I'm sure you're aware, that they have made this huge, shift from calling Alzheimer's, dementia, and now they're calling it type 3 diabetes.
Right.
Basically the type 3 diabetes has come essentially from the inflammatory effects of these, sugars, like the typical American diet. I mean, I didn't realize how bad it was until I really started to delve into it, where I remember I found a canister of salt, and inside the salt was sugar.
Wow.
And I think it was like more than salt. And I was just like, what in the world's going on here? There's like sugar in every single thing.
It's unreal.
Yeah. And just to your effect, you mentioned before, is like the difference between, monosaccharides or simple sugars versus more complex sugars. You had mentioned before that the polysaccharides contain information that the body uses to basically, have these effects. Do you feel like it's the polysaccharide structure that does that? Or is there any more clarity on the mechanism of how this kind of happens?
That's a great question. We look at, from those of us in more of the nutritional world, and I don't know how many of your listeners really focus on nutrition in their practice as much as they do, say, more of just conventional practice. But I mean, when you look at biochemistry in general, and again, the complexity of information in these polysaccharides is so much greater than in an amino acid or in a fatty acid, as an example. And then, of course, vitamins and minerals are much smaller, and then elements obviously are way smaller than those. But it's interesting that you cannot even completely characterize graphically these polysaccharides, because they literally are hundreds of glucose units attached together in these glycosidic bonds. But to answer your question, I think there's something very special. I mean, aloe vera and rice bran are not the only two things that Mother Nature gives us that contains polysaccharides. Obviously, just about every fruit, vegetable, grain, nut, seed, whatever that has some carbohydrate in it is going to have some polysaccharide content, especially things like different seaweeds, different mushrooms. Obviously, they have very significant components of polysaccharide content as well. But what I think is actually going on here is something even beyond the biochemistry level. And again, this is theoretical. I can't prove this yet. But one of the things I do hope to prove at some point in my career, in my life, is the physics component or the frequency component of food. I mean, if you think back to what Tesla said back in the early 20th century about the future of medicine would be around frequency, something like that. I'm butchering his quote, but he was basically saying that medicine will eventually, evolve into looking at frequency as a very significant component of healing. And so I think there's something very special about the aloe vera and the rice plants in general. So it's got to be, in my opinion, again, this is my opinion, this is theoretical. I think there's something beyond just biochemistry at work here. I think there's something about the resonant frequencies of these plants and how our cells recognize those frequencies and how they're just so darn receptive to utilizing them to then be guided and to help us function properly. To me, there's some, there's like, we have all of this information we've published, but then over here, there's like this big, kind of black area that we don't know. Like there's just so much that's unknown. And I think a big part of that black area lies in physics. And so I have a very strong motivation at some point, hopefully in my near future, to be able to go down that line of research and test this and then say, yeah, I'm correct, or no, I was wrong. But one way or another, I think there's something beyond biochemistry at play here that is the reason why these two particular plants are just so beneficial to human health. And we know that, again, rice has been eaten, especially in Asia, for millennia. We know that in recorded history, aloe vera has been mentioned as a healer. So, these are not, I'm not bringing anything new to the table here in terms of what humanity has known for millennia. But what I am doing is bringing to the table new information related to why these plants are so beneficial for us.
Absolutely. And so one of the things I wanted to show everybody, if it's okay, I was going to show them your website and also
Sure.
the product you make yourself as well here, just because I thought it was very interesting. Let's see if I can share the screen here. Here we go. All right. So here's the actual what's in the ingredients of the product. So we don't have
Yes.
anything weird. There's no, like this. That's what I love. Like there's no, paba or like anything like this.
No.
And so basically you have stabilized rice grain, golden flaxseed. Does flaxseed contain the polysaccharides as well?
Flaxseed has a little bit of polysaccharide content, but the benefit of the flax is the lignans. It's the highest content of lignans of any plant known to humanity. So as you may know, lignans are very anti-carcinogenic, just incredibly beneficial nutrients for us. And then, of course, omega-3 content, omega-6 content, fiber. I mean, flaxseed is just an incredible nutritional source.
That's awesome. And then would you mind commenting on some of these other components as well?
Sure. So the sunflower lecithin, I mean, that's an amazing source of choline. Choline is very important not only for our brain, but for our heart. Phosphatidylcholine is utilized by pretty much, again, every cell in the body. So that's another really amazing nutritional component. Lecithin also serves as like a natural emulsifier. So it helps other ingredients in the formula to be able to be absorbed better, essentially. So lecithin is just an amazing nutrient. The wild yam, I mean, Dioscorea is a very fascinating material. It's got these saponins, these different types of nutrients that have very significant endocrine effects. So this was really, and looking at this formulation, one of the nice things about it, Dr. Sewell, is that it's not, again, I mentioned the difference between the nutritional and the pharmacological paradigms earlier in our conversation. So daily brain care is not meant to be a magic bullet or, just a one, you see these so-called nootropics where people are, focused on caffeine or taurine or, whatever the main ingredient is. This is a totally different approach. This is giving the cells the nutrients that they need to function properly. And as you know, all cells need lots of different things all the time. They don't just need one thing or another. They need lots of things all the time. So this is the approach behind this formulation. The BioLo, that's our real. If you twisted my arm and you said, John, what's really the one thing here you can't live without in this formulation? It's really the BioLo. This is the aloe polysaccharide. This is in my opinion, and the people that work with that have created BioLo, this is the best aloe polysaccharide on the planet. It's the most bioavailable. Again, like the sunflower lecithin, it helps everything else to absorb better. So I just can't speak highly enough of BioLo. I think it is the best aloe polysaccharide on the planet. Tart cherry, again, just like the flax and the rice bran, it's loaded with all sorts of nutritional components. It's also a very good source of melatonin. So we get a lot of people telling us they sleep better taking daily brain care. So I would say that probably the tart cherry is responsible for that. NAC, I mean,
would you also mention the tart cherry? Does it also? Because I've actually used this on a few patients as like a tart cherry juice,
Yes,
and I tell them to start drinking this, and
absolutely,
and they seem to have better blood sugar. They seem to also, like you mentioned before, sleep better. They've even claimed that it has like weight management properties where they don't get as hungry. These kind of things.
I've read that as well. Yes, exactly. Tart cherry is amazing. It's a great nutrient.
You've made a beautiful supplement here. I mean, absolutely. And then N-acetylcysteine. We all know how important that is.
Absolutely, yep. And especially for your COVID folks and your people that have taken injections, NAC is very important. The calcium silicate clay, that's also a beautiful material that comes from a lake in Mississippi, actually. And Dr. Carpenter, the gentleman who owns the company who produces the clay, he's got patents behind how he extracts the clay out of that lake. And it's an amazing material. It's a very potent chelator. So it pulls out all of these positive cations that build up inside us over time, these different heavy metals, arsenic, other toxic materials that we don't want sitting around in our fat tissue, especially. So the clay is a very nice chelator. It provides all these different, it's a great source of minerals, but at the same time, it's pulling out all of the bad stuff from us. Citric acid obviously is very important for the Krebs cycle. It's also a very potent chelator. And then the IP6, the inositol hexaphosphate, that's also a very interesting material. It actually comes from rice bran as well. And it's also very anti-carcinogenic. So it's got some incredible studies behind it, looking at how it kills cancer cells. I mean, it just, what we feel like is a very complete formula to provide advanced nutritional support for really just everybody. I mean, there's no one who couldn't benefit from this.
So this should definitely be a cornerstone therapy for anyone who's dealing with patients with kind of any of these symptoms, cognitive decline, maybe if they're even having, patients that are diabetic, people that are at risk for cancer.
Absolutely.
I mean, obviously it sounds like you're using this as kind of like a base of your nutrition as well.
I do.
If as a physician, if say, because we have a lot of people that watch this, that we have a big chunk of them that own medical spas, a big chunk of them that are medical doctors, and then a lot of people that are functional medicine, some chiropractors. So it's kind of a podiatrist. Like we have a lot of different types of specialties that watch this. How would you suggest that like you might get started adding this to your practice?
So we have the website has email address and phone number on there, but even quicker than that, just go straight to our homepage, scroll down toward the bottom. There's a wholesale practitioner sign up. So if anybody would like to wholesale through their company, their practice, they can do that. If they don't want to deal with inventory, I know sometimes people don't want to deal with inventory. That's fine. Then we can make you an affiliate. We can just create an affiliate link for you. And that way you don't have to deal with inventory, and then you just get a commission on every sale. And then some people do both, actually. They like they like having their own affiliate link. They also like having some inventory in their clinic or their business or their store as well. So they can do both. But yeah, I'm happy to help anybody get set up with this, get started. Again, we can send you all the information, all the articles from the studies we published. We've got very nice brochures you can hand out for your patients. I would love to work with any of your listeners, and we try to make it as easy as we can.
Man, that is awesome. And I love the fact that it also has been shown to increase the active stem cells being released from bone marrow.
Absolutely.
We use cocoa a lot for that right now, because cocoa has shown some of that too. But just like this, I mean, what a great supplement. I mean, and I just showed for the listeners, I showed exactly how to get to the wholesale sign up. If you guys want to start an account with Dr. Lewis here,
thank you.
This is how you do it. But I think more than anything, there's a lot of people that are, practitioners that have been trained in the, allopathic system, which unfortunately has been corrupted by big pharma. And if people really start to look into the history of kind of what we considered what I call like mainstream medicine, it's been manipulated for a long time, unfortunately. And the thing is, the whole reason why most of us went into this was to actually help people. And now, I see more and more every day where there's just more and more doctors that are just like, hey, I'm done with big pharma. I'm tired of their lies. I'm tired of all the BS. I'm tired of dealing with the insurance companies. Like, this doesn't make sense anymore. We're not even helping people. They have stress out the wazoo. Physician suicide rates are higher than they've ever been in history. And they don't even measure like nurse practitioner suicide rates or, CRNA suicide rates. Like, those are also very, very high. And the thing is that, when you look at this, it's like, this is an option now for people to basically learn from your research and then be able to apply this to their patients, because patients are going to buy this anyway. They're going to be buying supplements from someone.
That's right.
You look at the supplement market, it's huge. So they might as well buy them from you, and then they could buy actually good stuff from you, because a lot of supplements, to be quite honest, I don't think, and maybe I'm curious what your opinion is, but what I've seen is a lot of supplements out there, they're full of filler. They're very questionable. We've sent some supplements to the lab to get tested, and they're not anything like they say they are,
Did you see that article? It was, I think, back in May. Now Foods conducted a study on like 33 berberine products. And of course, berberine is really hot right now. And like 8 of them didn't even contain berberine. Like 8 of the 33 had no berberine. And then like, I don't know, a few others were, like whatever it said on the supplement facts panel was like not even close to the amount that was reported. So you're absolutely right. I mean, it's really sad that there are just so many charlatans, not just in our industry, but really just in life in general. It's just mind boggling how many people try to be dirty and, break the law. And unethical, whatever. But and of course, you and I are just meeting each other. And of course, your listeners don't know me from anybody else they've heard talk. But I put my name. I mean, if it means anything to anybody out there, I put my name on the label. I mean, this is my life's work. And as I just mentioned to you, anybody can call. Again, I'm an open book. You can, the testimonials and the product reviews we have on our website, those are all legit. I mean, not one person has been paid to say anything about our stuff. Those are comments that people have made that they've, truly had their own experience with. Of course, in some cases, we've asked people to say, hey, you just told us something amazing. Would you please, put that on our website to help us out? But not one person has been coerced or paid or anything like that to say anything about how daily brain care or anything else that I've done to try to help people has how that's happened. So, but I'm like you. I mean, I wish, and hopefully over time, maybe as the industry evolves and better practices occur, regulation, I kind of, I'm a little bit iffy there. Like I don't want to see our industry get overregulated on the other hand, simply because then it kind of takes us down a path of drugs, and all that's going to do is increase prices. So I wish there was a way to regulate without, causing people to have to pay more money for that level of regulation. But hopefully over time, as people like me and you, and, as we do a better job of educating consumers and people get driven, the one thing that we can do as Americans, I mean, if you're upset about the way things happen on the national level, the one thing you can always do to make a change is, how do you spend your money and who do you support? If you support ethical people, good companies, you can make a difference. And hopefully over time, as the bad players get exposed and get driven out of business, that only helps people like me and the other good companies out there to continue being business and to continue providing education and actually trying to help people. And so over time, hopefully that kind of change occurs. I mean, I know that kind of sounds like pie in the sky, dreamy stuff, but maybe, over time, stuff like that can help to make the industry much better and give the industry a good name. I mean, I'm very proud of, again, all the work that my colleagues and I have done and what we continue to try to do. And so I'm just going to continue doing it the right way. Maybe that means my company never becomes, ultra successful financially, but so be it. I'm not going to sell my soul just to make a buck. Again, I'm a scientist learning to be a marketer, and I'll always look at myself as a scientist first and then a marketer second. But to me, that's just part of growth as an individual. And, again, trying to be a better businessman and maintain my ethics and my credibility at the same time.
Exactly. And all real successful businesses that have lasted the test of time at least started with someone like yourself who was ethical and honest. It might have changed over time, or, the generation that started it is not the same generation that inherited it, and, that kind of thing. But I'll tell you that, like, ultimately people are fed up. That's why you see, like, I think the latest statistic I saw was 50% of the country doesn't trust big pharma.
That's right. It's incredible.
And that was because of COVID. Like before COVID, like just think back to the 90s, how many people were excited about the latest drug released. Like, oh my gosh, there's a new drug. Did you hear about this? And now people are like, it's probably a trap. It's probably fake. It's probably some, and so that's because they have destroyed their goodwill with the public because of all the bad stuff they've done. But, I think this is a great example of, you're a great example of, building things that people need. And doing the best you can to educate them in a non-salesy or pushy way, and that's the best marketing you can get,
Thank you. I appreciate those kind words.
Oh, my pleasure. Well, if anybody wants to find out more or follow up with you, they just go to drlewisnutrition.com.
That's the best source. And all the same under the same name, under all the typical social media channels as well. But drlewisnutrition.com is really the best source of all the information. I mean, all the social media channels, of course, are geared toward just, kind of quick hit pointers, if you will. It's not extensive information, but our website is loaded with a lot of information, as you've been pointing out to our listeners.
Absolutely. Well, Dr. Lewis, thank you so much for coming on the podcast. We're so appreciative of it, and your message is amazing. I'm going to myself buy some daily brain care right now for myself and my family. And we're going to test it out on some patients as well. I always try it on myself first, and I try it on patients second. And then we'll go from there. But I think it's going to be a good solution for a lot of people with cognitive dysfunction these days.
I appreciate it. Well, let me know how I can help you and support you. And I'm very grateful to be with you here today, and so thankful for the opportunity to share my information and my message.
Well, thank you for your time, Dr. Lewis. Appreciate it.